Hello everyone, this is Dr. Sanket Pisat. I am a gynecological endoscopic surgeon practicing in Mumbai, India. And today we are going to be talking about what is hysteroscopy, what is laparoscopy, and whether you require hysteroscopy or laparoscopy or both for your present condition, which is infertility, and that means trying to get pregnant. So, first of all, let us try and understand what hysteroscopy is, what laparoscopy is, and how they are both different. We have detailed videos on these as well with actual surgical pictures and videos. And please have a look at the other patient information videos on this channel to get an idea of what hysteroscopy and laparoscopy is and what is found inside during laparoscopy. So, in order to cut it short, hysteroscopy is examination of the inside of the uterus by using a camera system, and laparoscopy is examination of the outside of the uterus and the organs that are surrounding the uterus using a surgical camera. Hysteroscopy is essentially performed by the vaginal route, meaning that there are no cuts on the abdomen, there are no stitches on the abdomen at all, and the patient is able to go home in 3 to 4 hours after the surgery. And laparoscopy has involves one or two small half a centimeter cuts on the abdomen, and the patients do require to stay for at least 8 hours to maybe sometimes overnight after the surgery. So, having understood that, in hysteroscopy, there are a variety of problems that can be detected. Some of these problems can be picked up by sonography, but some of these problems are not picked up by ultrasound or by MRI. And yet, these small, subtle conditions do cause infertility in a lot of cases. Let's look at what these pathologies are. The first and commonest pathology is an abnormality of the endometrium, which is called as a thick endometrium. The thick endometrium may also be sometimes a synonym for something called as an endometrial polyp. This endometrial polyp is an overgrowth of the lining of the inside of the uterus, which causes a problem for the pregnancy to implant itself. The other thing that could be found on hysteroscopy is a submucous fibroid. This is a fibroid growth. We have another video on what fibroids are and how they affect pregnancy, infertility, and who requires removal of fibroids and who does not. So that is also there available in the channel. But these submucous fibroids do cause infertility and need to be removed by hysteroscopy only. You may have other pathologies like an intrauterine septum, which is like a partition dividing the uterus into two halves. Or you could also have intrauterine synechia, which are sticky bands which develop inside the uterine cavity, mostly after a prior abortion. Now, many of these conditions cannot be reliably diagnosed by sonography alone. And hence, when patients have repeated failures at attempting to trying to get pregnant, we perform this in order to find out that everything is clear inside. Generally, for patients who are desiring pregnancy quicker and do not wish to wait for a longer period of time, we advise these tests after 1 to 1.5 years of regular intercourse and failure to get pregnant. So, that is the time period that is involved before these tests are to be done. Likewise, as in hysteroscopy, there is also laparoscopy. Laparoscopy is inspection of the uterus and the surrounding organs from above. That means not the uterine cavity, but the uterine exterior. And here also, we may find several conditions which had been missed previously. These could be small fibroids, these could be small ovarian cysts, and most of the times, fibroids and ovarian cysts can be picked up by a good ultrasound. But sometimes you also find something called adhesions. Adhesions are sticky bands between the uterus, the fallopian tubes, and their surrounding organs, and they do not allow the tubes to function freely. Hence, there results in difficulty or failure in getting pregnant, or sometimes, even if the patient does manage to get pregnant, there is usually an abortion. So, a lot of pathologies like fibroids, ovarian cysts, blocked fallopian tubes can be found on laparoscopy. And the best part of doing laparoscopy and hysteroscopy is most of these conditions can be treated in the same instance. After treatment of these conditions, obviously, subsequent attempts at trying to get pregnant result in success much faster. Also, if you are a candidate who is going to be going in for assisted reproduction later on, the chance of success of an assisted reproduction or IVF is also much better, because otherwise it is like shooting in the dark. So you are trying to get pregnant, but you do not know whether or not there is any obviously correctable problem inside. And if there is, at least I would recommend that these get treated first, rather than waiting and wasting years of frustration and then finding out that there was something inside that could have been treated and would have led you to achieving that successful pregnancy much faster and earlier on in your life. So that's all that we have in this particular video about hysteroscopy and laparoscopy. In order to break it in a nutshell, if the initial investigations do show any abnormality, then definitely hysterolaparoscopy is the way to go. And if they do not show any abnormality, after an adequate period of trial, my personal recommendation is that you do not waste too much time in waiting. Rather, find out what the cause is at the cost of a small surgery. And if there is something correctable, correcting that problem will lead to a tremendous increase in your success attempts in the future pregnancies. So that's all we have in this video. If you have any questions, please leave them in the comment section below. And if you like the video, please click on the icon above to subscribe to our channel and to keep receiving more updates. Thank you.